Good evening. My name is Odistine Moore, and I'm a registered nurse, and today I'm going to be talking to you about the effects of sodium on hypertension. By the end of this talk, you will know that there's a close correlation between sodium consumption and increase in blood pressure. And I also want you to know that once you reduce your sodium intake, it will also reduce your blood pressure. There's a traditional belief that sodium, is commonly known as table salt, can raise your blood pressure. Most Americans are salt sensitive, meaning they can just have a little salt and it tends to raise their blood pressure high. And they got one group in particular I want you to know about, and that's the African American population. African Americans tends to have more hypertension more than any other group. They just seem to get affected the majority of the time by hypertension. And it's primarily because of their diet and also because of health care disparities, meaning that they don't have adequate access to health care. Years ago, I could remember when I was growing up that my mother used to cook collard greens, cabbage. She used to use pigtails. She put the pigtails in the red beans. We would eat a lot of bologna. All that kind of stuff, processed foods. Processed foods tend to have a lot of sodium and nitrates, which tends to affect your blood pressure. And high sodium intake causes increased arterial pressure in your vessels. And it also can lead to some inflammation in those vessels as well. Now that we know the effects of sodium, let's talk about what hypertension is. Hypertension is defined as the force of blood pushing against your arteries, the wall of your arteries constantly, and it stays high. There's several stages of hypertension. They just changed the guidelines several years ago. We used to say that 120/80 was stellar blood pressure. But now that if you have anything over 120/80, 121/81, you consider to be in pre-hypertension. 130s, you're in stage 1. 140s, stage 2. 180s, hypertensive crisis. There are different symptoms with hypertension. Sometimes you don't even have any symptoms at all. So that's why it's also known as the silent killer. Here are some symptoms of hypertension. Nosebleeds, headaches, chest pain, fatigue. You can have difficulty sleeping, sexual dysfunctions are all symptoms of hypertension. But there are some risk factors that causes hypertension. Age, race, like I said before, African Americans have the highest incident of high blood pressure. Having a family history, hypertension tends to run in families. Being overweight because your body needs to supply more oxygen to all the extra tissue. Not being physically active, not exercising, being a couch potato can also lead to hypertension. Smoking, and like I said, boom, sodium. Increase in sodium tends to raise your blood pressure. Let's talk about some treatment options. The first drug of choice when you first get diagnosed with hypertension is diuretics. That's your first line of drugs. Then you may be put on an ACE inhibitor or maybe a calcium channel blocker. Also is a great treatment for hypertension. Then they may put you on an exercise regimen as well as a low sodium diet or a heart healthy diet. All these things can lead to better blood pressure. Now that we've defined what hypertension is, gave you the stages, some symptoms, some causes, and some treatments, I just want to reiterate that there is a direct correlation to hypertension, and it's recommended that you reduce your sodium intake. The American Dietetic Association states that you should have about 2 grams of sodium a day. But if you even cut that in half to maybe 1,500 milligrams to 1,000, you can reduce your blood pressure by 5 to 6 millimeters of mercury just by doing that. So I want you to start to read labels, take seriously a diet that's low in sodium. And I hope you just got some really good information from this talk. And thank you for your time and your attention. Thank you.